Singh. I'm with DK Singh, the political editor of ThePrint, and this is a special edition of his show, Politically Correct, where DK will answer all your questions on this week's episode, which is about Arvind Kejriwal and his handling of the COVID crisis in Delhi. DK will take you behind the scenes and explain to you just not the politics about it, but how Arvind Kejriwal compares with the other states in the country in handling this epidemic. DK, welcome to ThePrint. Your first comments on how Arvind Kejriwal has handled this crisis.
On the face of it, he looks like a symbol of hope. I mean, if you have been watching him closely, he started with, say, that's about 1.5 months back. Then, don't worry, someday Hanuman will bring you the Sanjeevani.
No, is he the Hanuman? Is he saying that he's the Hanuman who's going to bring the
basically
Sanjeevani?
Trying to become the symbol of hope.
Right.
Then he tells you, every day Gita has 18 chapters to read one. Then you heard him talking about plasma therapy, how it's working. Of course, once the ICMR clarified that there is no proof of its working, the plasma therapy working actually, he gave up. But every time you see him talking very positive things. So some doctor doing some interesting things, say that AIMS doctor who did not wear the mask because some patient needed his immediate intervention. Kejriwal would be celebrating on Twitter, saluting doctors. Some doctor had done something. So all the positive vibes that you can get, that you have. But when it comes to the crunch, there are lots of questions he needs to answer. Now, if you look at the latest figure, the Delhi COVID positive numbers have gone up to 15,257. In fact, in the last 24 hours, we have seen the biggest spike, almost close to 800.
Right.
The previous day, again, that was another record, 500 in one day. Positivity rate in Delhi is not very good. It's over 8% now. What, 8.27%?
Of the population?
No. Basically, people who have been tested and who have turned positive.
Okay.
So over 8% is
high.
It's high. Because that's what Gujarat has. Bombay has more, Maharashtra has more, it's about 12%. But
what about Tamil Nadu?
Tamil Nadu positivity rate, I don't remember, but Maharashtra, Gujarat, Delhi, I know it's pretty high. Maharashtra is, of course, the highest. One good thing is, the fertility rate is pretty low in Delhi. It's 1.98%, so not even 2%. So that's very reassuring. But then the questions I was talking about, look, we have seen a lot of reports. Now, the trust in the official numbers. Somehow you are not able to repose that trust in those numbers.
So, DK, I'm going to interrupt you here because we have a question on exactly this by Sujit Krishna, who wants to know, is Kejriwal actually hiding fatalities or deaths?
I think he must answer, because we have seen many reports. ThePrint has also done a lot of reports. Now, when the Delhi's official figure was less than 200, we had COVID-designated cremation and burial grounds. Their number was about 550. Now, there was a big discrepancy. Then you had reports about Delhi government hospitals, their figures being much higher than the official figure. We have not heard anything from the government on that. All that you heard was, okay, we need to basically match our figures, there is something wrong.
But when you ask these questions, when reporters from ThePrint also, when they ask these questions, what
you don't get any response. See, it's a one-way traffic. So Kejriwal tweets, he does video conferencing, and mind you, he does not interact, he does not come out of his house.
So he's not taking questions even virtually from reporters?
No, I'm talking about just about the numbers, discrepancies numbers. Look at the number of containment zones. See, at one point of time last month, Delhi had 102 containment zones. It came down to 62, 64 when you were seeing a consistent spike in numbers. Now it's 90 plus. So how do it go up, come down? How do you decide when you have a spike in numbers? How does the number of containment zones come down? Then you suddenly heard Delhi government issuing an order saying that you cannot do a COVID test on dead bodies. Now that's against the guidelines of both the Indian Council of Medical Research and the World Health Organization.
So he's not, so are you saying that Arvind Kejriwal does no press conferences where even virtually
Virtually he does. No, that he does.
But when he's asked these questions, what does he say? Or he doesn't say?
No, I haven't really seen him answering these questions. So he has to come out, because what you notice here is this: he is following some kind of West Bengal pattern, I would say. This was exactly what Mamata Banerjee was doing there. Now,
She was doing.
Yeah, because there also there were lots of doubts about the death figures. Then she set up a committee, death audit committee, which would certify which death was because of COVID, which death was not because of comorbidity. So that won't give you the exact figures. In Delhi also had this. Delhi also had this death audit committee.
Right.
Although the High Court has supported it.
Yeah.
But point is, why do you need that committee? Let the hospital decide. Why do you not want to test dead bodies?
So two questions, DK. One is from Raghavendra Singh, who's asking, and this is a question to us and the media. Why is the media silent on the Delhi government, not giving data despite the High Court orders? And Piyush Singh, okay, so why don't you go ahead and answer that?
No, we have been raising questions. Just that Kejriwal, what he has done, see, he's a great leader when it comes to managing optics. So every day you have him showing videos, doing some video conference, tweeting something, keeping you busy. So constantly he has your eyeballs. So whatever the media is reporting, he does not even bother to respond to those questions. Now, some of the questions I talked about, death figures, containment zones, you have no answers from the government. Now, you heard him talking about, just 2 days back, Delhi government issued an order, like, okay, 117 hospitals in the city will have to reserve 20% of the beds for COVID patients. Now, the medical bodies, medical associations, and many senior doctors, they are very upset because they are saying this is what Italy, Spain, and other countries did. And actually, that resulting in a spike in figures, because you cannot have COVID and non-COVID patients being treated in the same hospital. Now, if AIIMS is doing it, so AIIMS has this COVID thing. One is at Trauma Center Ring Road, another is in Jhajjar. But when you go to AIIMS, the main building, you don't have COVID patients there because you don't want to mix them.
Right.
But the simple order, Delhi government has decided, so good for optics. Okay, Delhi government has made this decision. Delhi government has ordered 117 hospitals to do that. You feel happy. But then he's never talking about the dangers.
So, DK, here's a question from Piyush Singh, who's asking, is the Kejriwal administration trying to balance its show of support towards the center and also taking an independent stand?
See, every time you see some criticism about the center, it's at best muted. And it's not very aggressive. The old Kejriwal is gone. You see a lot of coherence between what the Delhi government is doing and the center is doing. Now the same things.
But that's a good thing, isn't it? Because in a crisis like this,
no, but point is when
states and the center must work together.
No, my point is when Mamata Banerjee government started doing that, the center sent 2 medical teams to ascertain the facts, and that forced Mamata Banerjee government to back off. So when Mamata Banerjee government was actually having a team of doctors to certify deaths, COVID deaths, non-COVID deaths, then the central team wanted Mamata Banerjee government to give the medical records of all the patients to ascertain which was COVID related, which was not.
Right.
And at that point of time, Mamata Banerjee came out and said, okay, there is no such committee. She changed it completely.
Now, so she fell in line.
Yeah, that was under central pressure. And so today actually, Mamata Banerjee, she has spoken today, and now she is saying, okay, because I am not able to manage it, it's such a huge task. She is saying, okay, the Prime Minister should come and intervene. Why don't the Prime Minister come and help us?
So she is reaching out to the center, to the Prime Minister, and seeking help.
No, all I am saying is seeking help, yeah. But that could be for political reasons also. Okay. Because see, it's unmanageable. I mean, COVID, we don't know which way it's heading. So she is trying to shift the blame onto the center. But we are not discussing Mamata Banerjee. Coming to Delhi.
Yes.
I'm saying when Mamata Banerjee government sets up a committee, the center takes some risk, center asks for details and forces the government to back off. When Delhi government has it, you don't hear anything from the center. When you have discrepancies...
But why not? Why not? Can I ask you why not?
Because somehow we see in this term of Kejriwal government, we see a lot of synergy or some kind of understanding. You don't really see very aggressive targeting of each other.
But why not?
Possible, because Delhi, you don't have any elections in Delhi for the next 5 years. Even Lok Sabha elections are 4 years away. And then Kejriwal, he is talking almost like the Prime Minister. Gita ka chapter ye kijiye. If Prime Minister is talking about, the lockdown, being able to end this in 21 days, you have Kejriwal talking about Hanuman bringing Sanjeevani.
Tell the viewers about this Hanuman and Sanjeevani. It's a beautiful story. Let's hear it.
He's just saying that Hanuman, you wait for the Sanjeevani, Hanumanji can bring Sanjeevani. But that was what 1.5 months back. I'm just saying the messaging. He's just copying or emulating the Prime Minister.
So some are saying that he's behaving like a Chota Modi.
Yes, and everything that he does. And he has been, not just now, he has been doing it for the last 6 months, for 1 year I would say. That's how he modeled his election campaign also. And in terms of COVID management, you see the same model. I mean, no questions being answered, so you don't ask any questions.
Right.
It's always a one-way traffic.
Okay, so there's another question that's come up from Gagandeep. He wants to know, can easing out of the lockdown, gradually exiting the lockdown, lead to a much more difficult situation in Delhi?
Well, if you go by the Delhi government's claims at least, there would be, of course, there may be a spike, because once you relax restrictions, there may be a spike, but the health infrastructure has got ramped up. I mean, that's what we are given to believe. 2 days back, Kejriwal was talking about, the number of beds in Delhi, for instance. In government hospitals, you have 3,800 plus beds, 3,880 or 90 beds, out of which only close to 1,500 are occupied. In private hospitals, you have about 677 beds, of which 509 were occupied. So there is no dearth of beds available if we go by the government's claims. If you go by the ventilators, as he says, again, out of 250 ventilators, only about, in Delhi government hospitals, only about 10 or 11 are in use. So at least health infrastructure by Delhi looks equipped. Probably when you see a spike, we can probably deal with it. And low mortality figure is a big confidence building thing for us.
But I think we also have to consider that Delhi's population is 20 million. It's, it's bigger than some countries combined. So in that sense, if Arvind Kejriwal is coming across as a bit of a dictator, probably he is using the lockdown that was imposed by the center to put these health systems in place.
That every state has done. That was one of the objectives of the lockdown also. Centrally, to ramp up health infrastructure at the central level in the states. That lockdown has given that leeway to every state. Delhi has also done that. It's a good thing.
And therefore they have, like you talked about, that they have hospital beds. Perhaps they have enough quarantine centers. We don't really know.
I'm worried about something else. First, the reliability of the government figures. I don't know how reliable it is, because as we discussed, official figures, there's a huge discrepancy between official figures and what we collect from burial grounds or cremation grounds and hospitals. That is one. Secondly, when you talk about, now you see the Chief Minister saluting the doctors, you see the Chief Minister talking about health infrastructure. Have you gone to the hospital? I mean, just the other day you had this case of a 46-year-old nurse getting infected and finally succumbing to it because she was forced to use the used PPEs, that personal protective equipment. And I've been talking to my friends in other hospitals. So many of my friends are buying their own PPEs because hospitals are not providing them. Now in that Ambedkar hospital last month, there were about over 100 cases. That became a cluster actually, the hospital. How equipped are the hospitals? Has the Chief Minister gone there to check? What's being provided there? Have you gone there to check?
We haven't seen the Chief Minister go to any hospital in these last 2 months.
So lots of announcements. Now when you are facing this migrant crisis, now you heard the Delhi government talking about this tie-up between the government and Google Maps. So anybody who wanted to go to a food or relief center or those shelters, could go to the app and get the exact location of that shelter.
Right.
Our team went there. The print sent several teams to migrants. Now, first of all, they didn't even know about it. Most of them did not have the smartphones. Even if they had, it was prepaid. They didn't have the money to do it. And then they didn't even know how to go to that app.
Yeah.
Then there was another system where there is called Doc, I think, that was the name, another app. So you could call any doctor for medical emergencies. None of the migrants we visited had any idea about call Doc. No, just about a couple of hours back, I was trying to check, the Delhi government has been claiming that it gives 5,000 rupees to the drivers of 5,000 rupees each, to drivers of public transport, e-rickshaws, autos and all that. So I was just opening the site, Delhi Transport Department site, to see the details, to apply for this actually.
Right.
Just wanted to know whether you can apply it. I have waited for an hour, it is yet to open.
I see.
Then there is another link which tells you, okay, check the status of your applications. Even that link has been opening for the last 1 hour.
So, DK, what about the public distribution system? You mentioned the migrants. I mean, we saw how Delhi was really in the eye of the storm.
See, again,
2 months ago
again, the claims and the fact on the ground, there seems to be some kind of discrepancy, because the Chief Minister has said that, about 1 crore people, close to half of Delhi's population has been given 5 kg of food grains. But then in the first week of May, you heard Ramvilas Paswan actually tweeted, the Food and PDS Minister. He tweeted that there was another scheme of the government, that is the Prime Minister's Yojana, that, okay, Delhi had been allotted, I don't remember the exact quantum, but it was something like 60,000 metric tons of something, of food grains. And Delhi was able to lift just about 1% of that.
Right.
Now, given the ground reports where you go to all these shelters, you find these migrants hungry, and then you claim that you have already given this much to 1 crore people, and then you're feeding 10 lakh migrants every day, you go to the ground, go to any shelter.
So somebody is fudging the data.
It's about creating that impression. It's about optics. No, now you and I'm a journalist, you're a journalist, we can go and check. But people listening to him, people watching his Twitter handle, won't go to the ground to check.
DK, another question from Anish Tiwari, who's asking, is it because there is much more testing in Delhi that the numbers are higher? For example, in Telangana, there is very little or no testing at all, so therefore there are no numbers, so we don't know. So we all believe that Telangana is COVID-free or somewhat free.
Point is, how much testing is enough testing? In Delhi, so far, Delhi testing number is 184,000. That comes to about 9,200 per million. Is that good enough? We don't know. Maharashtra has been testing a lot. Every state is seeing that huge, increase in testing numbers. Except a few, of course. UP is not doing well. Telangana, you mentioned, yes. There are many states. But states you find like Tamil Nadu, Maharashtra, where you see a huge spike in numbers of infections. I mean, more tests give you more infection numbers.
Right.
Delhi is doing well now. Initially, it was a bit sluggish, but now I think it's ramping this up again. The 9,200 per million is not a bad figure, but the more testing you do, the better it is.
Right. That of course. So here's another. This person hasn't given his real name, but the username is Tech Diaries, and he or she is asking, don't you think that that central government's help, I mean, not far from the center to Delhi, is not reaching Delhi, and that has tied Kejriwal's hands?
Not really. Center has been there. As I said, there is total coordination between the center and the state. Now, for relaxation, for instance, now Kejriwal had asked for suggestions from the people. 5 lakh suggestions came.
Yeah.
And Kejriwal himself has claimed after the guidelines were out from the Ministry of Home Affairs, he said most of his suggestions were accepted in terms of relaxation. But yeah, coming to that 5 lakh suggestions, now it's a magic number, because on 14th he got 5 lakh suggestions as he tweeted. And 2 days later, he claimed that he has gone through everything and he has read all the suggestions and made the recommendations to the center also. Now, that's really magical. But well,
Well,
I
he
mean,
works very fast.
that's about Kejriwal's claims.
That's right. But
So
he
look,
also has-
I'm not suggesting that he's not doing anything.
Sure.
Every chief minister would try his best.
to keep his people healthy.
Yes, and he's also doing that.
Yes.
And you can't even dispute the fact that if he's doing all the talking positive things every day, I mean, conveying something to people every day, that's also a good step.
Yes.
But there are many lacunae that he has to address. The discrepancies we talk about. Because to convince us to actually win the trust of the people that you are fighting, you have to be honest with your numbers.
Absolutely. So this transparency is essential.
There is a big question mark there. I think Kejriwal needs to clear the air on that.
Right. I have a couple of comments, and one of them is that Kejriwal really loves his odd even. You know, we saw this in terms of air pollution a couple of years ago and last couple of years, and now again in the shops. Odd shops open one day, even numbered shops. It doesn't, you know, it's all leads to confusion.
No, it doesn't really work practically. I mean, it sounds good, but you know, implementing it on the ground is going to be very difficult.
Right. So a lot of show, perhaps not as much substance. I hope Arvind Kejriwal's team has been listening to DK Singh. And thank you so much for all your questions. Please keep watching and subscribe to the YouTube channel and follow us on social media. Thank you so much.